Okay, always BSI, scene safe in any patient contact. Indications for suctioning is, of course, any kind of vomitus or sputum in the nasal cavity or the oral cavity, because you don't want patients to aspirate. So, and we begin by performing a full respiratory assessment, but since we have a dummy here, we're just going to say we've listened to lung sounds, we know we have the indications, we have the secretions. So we'd begin by, if the patient was already breathing, we'd begin by just attaching them to high flow oxygen before and after each attempt of suctioning. So starting out with 15 liters per minute on a non-rebreather. Try to be a little bit more gentle with your patient. Okay, so then after that, after we've oxygenated our patient, we're going to gather our testing equipment and test our equipment for suctioning. We've got good suction there, and we'll start with a soft catheter for suctioning, and we'll actually do the nasal airway first. And the way we start is by measuring from the nasal cavity to the earlobe, so you know that's about how far you can push it in. And then we'll go ahead and set up our suctioning and begin. You can go ahead and turn it on and go in, and no longer than once you start suctioning by placing your finger here, and no longer than 15 seconds as you slowly come out. You got the suction there. Okay. All right, 15 seconds in, I want to clean my catheter here with some sterile water, and then I'll hopefully not have it pop out on you like that too. But then you can do it again, and then the same procedure for oral cavity with the soft catheter. You go from the earlobe to the tip of the mouth. That's how far you know. You can, go back in for that far, 15 seconds. You don't have to be able to see with this one because you're not going to do any damage with the soft catheter. 15 seconds. All right. We're going to clean again. Alright, and then we also have the rigid catheter. How long has it been off?
Just fell off.
Then you also have your rigid catheter. Now this one, let's just say our patient wasn't spontaneously breathing, we'd have an assistant ventilate for us for 2 minutes before and after each suctioning attempt. Christian is going to do a fantabulous job of showing us ventilation in a non-breathing patient. That'll be fantastic, thank you. Now to begin suctioning, with this one's a little different because you can go in only as far as you can see, so there's no need to measure. So we're going to go ahead and, as far as I can see, only in the oral cavity, we'll begin suctioning, no longer than 15 seconds. On the way out. And we're going to clean again before we go back in. But at this time, we'd go ahead and continue ventilations with our patient. Ta-da!